Hi, good afternoon everyone. I'm Dr. Anne Minnie Matthew. I'm working as the head of Department of Gynaecology in Aster Hospital, Mankhool. I am here today to tell you a few things, very important few things about endometriosis. March being the month of endometriosis awareness, you all would have heard quite a lot about endometriosis. But I have a very important message to all the girls and women out there. Don't ever think that womanhood is associated with pain and we are to deal with the pain just by ourselves because it's part of being a woman. No, never. Endometriosis can give you excruciating, debilitating pain during periods. And it is one of the most painful diseases ever diagnosed. So, it is very important that if you ever feel pain during periods, pain during sex, pain during the other days of the month, and if you have intermenstrual, that is bleeding in between periods or excessive bleeding, you should address, and you should never be ashamed of talking about your periods. You should communicate it with others, and also you must meet a gynecologist if you have any of these problems. Why? Because on an average it takes about 7 to 10 years for a diagnosis of endometriosis if you ignore it and if you don't go to the right person. So it is very important that you get it addressed as early as possible. Endometriosis has a very good prognosis if it is treated early enough. So it will equip you to live well and to live better with endometriosis. And unfortunately, endometriosis is a disease which does not have cure. But that doesn't mean that you have to live in pain. There are a lot of methods of treatment, including medications, hormonal therapy, surgery, excision of the endometriotic cyst. So it is very, very important that you see the gynecologist if you have any of these symptoms. And what I want you to know is endometriosis can affect women of any age group, from adolescent to the postmenopausal. Though we consider that endometriosis is a disease of the woman of a little older women. No, it can affect a girl who is as young as 13 years also. So if you have pain that is just a cramp, or which just goes away with an analgesic, it's fine, that is normal. But understand that menstrual pain never stays beyond a few hours normally. So if you ever face with such a situation, again and again I'm telling you that you must meet the gynecologist. Endometriosis does interfere with your fertility potential. Actually, about 30 to 40% of women who are infertile or who need assistance with fertility, they do have, 30 to 40% of women do have endometriosis. But it doesn't mean that you are infertile. If you take the right treatment early enough, definitely you can have babies. And it is important that you do not delay having a child when you have endometriosis. And the next thing I want you to know is, when you're diagnosed with endometriosis, if you have to go in for a surgery or treatment, make sure that you choose a doctor who is experienced and skillful enough to do your surgery, because the experience and the skill of the doctor makes a lot of difference in endometriosis surgery. So I want you to remember these 5 things again and again. If you have pain, pelvic pain, pain during sex, period pain, never ignore it. Secondly, if you are diagnosed with endometriosis, get treated as early as you can. Thirdly, If you're planning to have a child, never delay it if you have endometriosis. And fourthly, you have to realize that endometriosis can affect women of any age. So if your daughter, if your sister, or if your mother complain of pain during periods or through the other days of the month, make sure that she sees a doctor. And fifthly, I want you to understand that you should choose your doctor well, because the skill and experience of the doctor really does matter in the treatment of endometriosis. I hope this small talk would have enabled you to face your endometriosis better, and we are here to treat you well. See you.